Hello beautiful people, welcome back. Thank you for tuning in with me, your favorite service provider for your reproductive health services. And today we're going to talk about a topic that is very neglected, that is very misunderstood, a topic that most of us don't know about, a topic that most of us have no information about, and a topic that most of us love to ignore. But then it's very important that we all get to know it. So today, ladies and gentlemen, young and old people, friends, buddies, today we're going to discuss about cervical cancer. Cervical cancer is a disease, the cancer of the cervix. Cervix is a part of the reproductive tract of women. It is what we call the neck of the uterus. It is that part between the uterus and the vagina in the female reproductive tract. So we are going to discuss cancer that attacks this particular part. This is a disease that we can avoid, but unfortunately it is a disease that is killing over 3,000 mothers every year in Uganda. It's very sad because we know very well that in most of our communities, our mothers are taking the lead, taking part in different programs to support our homes, and it is so sad that we are losing them to a disease that can be prevented. Cervical cancer is caused by a virus known as human papillomavirus that you can get through sexual intercourse with an infected person. And that's why most of our discussion is going to be centered around good sexual behavior, as we shall be discussing even in the future. So once a woman is infected with human papillomavirus, this virus invades the cells that are inside the cervix. And with the time, over a period of time, between 5 to 10 years, a mother is likely to develop cancer because of the changes that are caused by this virus. So we are going to look at the risk factors, the signs and symptoms that someone is developing this cancer. We are going to look at how do we test for the cancer, and also treatment and other things in details. Therefore, having very many sexual partners, or what we could call multiple sexual partners, is one of the factors that is going to expose you or put you at a very high risk of developing this cancer. The other risk factor is HIV positive and HIV positive serostatus. So what happens with HIV is that very many people, a huge percentage of people have this virus, but this virus tends to be opportunistic, meaning it will affect you because of a lowered immunity or a compromised immunity. Therefore, being HIV positive puts you at a higher risk of getting this cancer. And then another one is smoking. Another risk factor would be STDs. If you're exposed to very many sexually transmitted diseases, that means there is a chance you've also gotten the HPV. Another risk factor is family history. Once you have a female relative who has suffered from this cancer, there are high chances you're also going to suffer from cervical cancer. Now, the fortunate bit about the topic of cervical cancer in general is that cervical cancer comes with a precancerous stage. And while we are carrying out the tests, that is what we look for. So in most cases, while this is developing, you will not have any signs and symptoms. It is asymptomatic, meaning unlike malaria where you feel headache and fever and then you decide to go to the hospital to get treatment, for cervical cancer you may not feel any signs and symptoms. But some of the signs and symptoms that present when someone is having cervical cancer, the first and commonest one is the lower abdominal pain. You find that a lot of mothers will present with lower abdominal pain, and even after being treated, it is not ceasing. It keeps on coming back. You keep on treating it over and over again. Another one is an abnormal and very smelly vaginal discharge. Once you notice you have an abnormal smelly vaginal discharge, please don't sit at home. Make sure that you go to the hospital and have a checkup. Another one is fatigue. All the time someone is fatigued or they feel tired. And then another one is painful sexual intercourse, or what we call dyspareunia. You have sexual intercourse with your partner and then you feel pain. Or some women may experience bleeding after sexual intercourse, or some women may experience bleeding at a time when they don't expect to bleed, or at a time when you're not in your periods but you find yourself having vaginal bleeding. So we are going to look at a test that we can do to check for cancer. As we said, we are doing cancer screening. Screening means we are getting very healthy individuals from the population and then carrying out a test to see or to check for the pre-cancer stage of the cervical cancer that we talked about. The commonly available test is visual inspection with acetic acid. That is very common. You can get it from different clinics, from different health centers, because currently very many different healthcare providers are trained to provide that test. It is not only done by physicians but by midwives, nurses too, at any level. Everyone can do that test as long as they've been trained to do it. So this test will last about 3 minutes. It is not painful at all. It might be a bit uncomfortable, but it is not painful. And the way it is done is that we have to look at your cervix using our eyes. That's why it's called visual inspection with acetic acid. Acetic acid is a chemical that we use. We put it on the cervix and then it will show us in case there are any changes. These are changes that, if not treated, will lead you to get cancer of the cervix. Now, mothers who are pregnant are not to be tested using VIA or any other method. We are not currently testing women who are pregnant, and postpartum mothers up to 3 months. So meaning after you have your baby, you have to wait 3 months in order for you to be tested. And another issue is age. We are testing females starting from the age of 25 according to Ministry of Health, Ugandan Ministry of Health guidelines. The reason as to why it is age 25 is because, as we said, cervical cancer comes as a result of infection with a high-risk human papillomavirus, which is spread through sexual contact. And it has been established that in Uganda, the average age of women's first sexual debut is 15. So when you give a time period of about 10 years under which this virus will start causing changes on the cervix, that puts you to 25. That's why we are screening mothers or ladies starting from age of 25. And also early sexual debut or starting sexual intercourse at a very early age is also another huge risk factor. I might not have mentioned it, but it's also another huge risk factor for you to contract the cancer of the cervix. And then another one is that for clients who are HIV positive, as long as you're sexually active at any age, you can be screened using VIA. So another thing about VIA is that we are screening mothers who are still seeing their periods, or in other words, we don't screen mothers using that particular method who have gone into menopause. Menopause is a time when a woman has stopped experiencing their menstrual period, and the reason is because this is a visual method of screening, and when mothers go into menopause, there are some structure changes that occur in their reproductive tract that would not enable us to see any results in case we are using the VIA. Therefore, we use another method called a pap smear. The commonest one is VIA because for it takes a very short period of time, and also your results are available there and then. Immediately after screening, your results are available. So after your screening test is done, if you're found that you're negative, we advise you to do this screening again after 3 years. And if you're found to have a precancerous lesion, we say this screening test is specifically looking out for the precancer stage. If you're found to have one, there is treatment. We have different treatment modalities, including cryotherapy, thermocoagulation. You can still access treatment there and then if you qualify to get that treatment. So we must be wondering, how can I prevent myself from getting cervical cancer? Now that we know what it is, we know the signs and symptoms, we know how we carry out the test and all that, we want to find out how can we reduce the risk factor of us getting cervical cancer, or how can we prevent ourselves from getting cervical cancer. Number one is that delay first age of sexual contact. We say that is a major risk factor. It puts you at a higher risk if you start having sexual intercourse very early on. And then another thing is try to avoid having multiple sexual partners. That is another thing that puts you on a risk. And in case you're having sex, please have protected sexual intercourse. Now, as part of prevention, currently there is a program on immunization of girls who are 10 years old or in primary 4 for the school program. Why they are targeting these girls is because we assume that at that age, these people have not had any sexual contact. But ideally, if you've not had any sexual contact, or if you screen negative for HPV DNA, you're allowed to get a vaccine. There is a vaccine, or we'll call it immunization, for cervical cancer. That is part of our primary prevention of the disease. For those of us who have already had sexual intercourse, the way you can prevent contracting this cancer is through routine screening. We said for those who are HIV negative, it is every 3 years. Those who are HIV positive, every year. Why is it important that you routinely screen? We said this cancer presents with a precancerous stage. So if we get you with a precancerous stage, you can easily be treated. The treatment will take about 5 minutes. It's a very simple treatment thanks to technology, and then you're able to move on with your life. But if you don't carry out the screening and then you develop the cancer and then you proceed to different stages, there might be close to no help for you. Thank you for tuning in today with me, Aisha. Please feel free to comment below. If you have any questions, we'll make sure to answer all of you. And if you have any topics that you'd like us to discuss about, please give us your suggestions. Thank you so much for tuning in to Nexus TV channel. Make sure that you subscribe, share the video, and give us a like. Meet you next week. Ciao.